Good afternoon, everyone. Thank you all for taking time out of your busy lives to come here. Thank you to my dear friend and a great voice and leader in Angie for joining us. And someone I always knew was a voice that Minnesota, a voice of the future, a voice of leadership, a voice for children, a voice sometimes for the voiceless, who has become my closest friend and partner in this together, Peggy Flanagan. And for the rest of the Minnesotans that you're really here to hear from, we're here today to make sure that we stay focused. And I was just mentioning that political campaigns should be, when they're done right, a platform to raise the issues that impact people's lives. They should be used by those voices that we do to improve our communities. And this issue of the absolute belief that Peggy, Angie, and I would think the folks up here will illustrate clearly that that absolute right and need to have health care, accessible, affordable, equitable health care, and understanding that we as elected leaders or policymakers need to be able to hear from the folks and the impact that it makes. And I think in this time we've seen it, trying to make this a philosophical discussion or trying to debate the role of how much government should be involved with this takes away from the central piece of this, that healthcare is at the center of people's lives. The healthcare is about individuals. And that piece of it is going to require hearing those stories and working together as Minnesotans do, and as Peggy and I have been talking about for a long time. When we join together as one Minnesota, we find solutions. When we use the resources that we have here, this is a state that will cover every single person with affordable health care. That is a must. We need to talk about the policy positions to do that, Minnesota Care buy-in. But this is a state that doesn't, as we're often saying now, we don't fear the future, we create the future in this state. So when we have folks here talking about this is the state that's not only going to get people covered for insurance and get that quality, affordable, equitable health care access, we're going to be the state that cures cancer. We're going to be the state that moves to the wellness. We're going to be the state that understands it's about improving lives. So I want to thank all of you for being here in this conversation and lifting up to the center of a healthcare debate people and what it matters to them, and that's what you're going to hear from. And nobody has done that better and articulated that clearer than my good friend and the next representative from the 2nd Congressional District.
Thank you so much, Tim. It's such an honor to be here with you and with Peggy and with all of our panelists. And thank you to all of you for coming out this afternoon. I wanted to just acknowledge, first of all, Rabbi Morris Allen. Thank you so much for opening up the synagogue, and Representative Matt Klein, our great senator, and Representative Rick Hansen. Yeah. Thank you for being here. Look, for most of you, you know that I grew up for a part of my childhood without access to health insurance. I also spent over 20 years working in a healthcare manufacturing company. And so this is really, really a very personal issue to me and why I'm so passionate about it. I know a lot of you in this room today, but I don't know all of you. For all I know, you could be Democrats, Republicans, or independents. And the truth is, it doesn't matter whether you're a Democrat or Republican or an independent. Because when you get the health care bill in your mailbox, it doesn't have a D or an R beside it. It's coming to you, and this is one of the most personal things that you will deal with is the health of your family. And so it doesn't escape me today that as we're sitting here today offering the opportunity to have a good discussion and get input into how we create affordable, accessible health care in Minnesota, that my opponent, Jason Lewis, is getting ready to attend a rally in Rochester. And what I'd love to ask him here today is, and this is the one moment, the searing moment of this campaign for me was back in May of 2017, when so many voters inside the 2nd Congressional District were literally begging to tell the congressman how gutting providing protections for pre-existing conditions would impact them and their families. How voters in this district were begging him to come forward and hear their stories. Well, I plan to do forums like this, at least publicly available forums, at least once a month as a member. Because I think the job is actually to listen to all of you. Because it's going to take all of us working together to solve the issues that we have in healthcare. We are so lucky to have a senator from this part of the district who's a doctor, Beth. And I am just absolutely confident that working together that we can solve these issues, that we can fix what's wrong with the health insurance marketplace today, that we can bring down the cost of premiums and deductibles, because no matter what you say, almost every discussion of healthcare over the last decade has been about how do we make health insurance more affordable. We have got to expand that discussion to how we make healthcare more affordable in this country. So it's such an honor and a privilege to have you here today. Thank you for being here. And with that, we're going to ask Peggy to say a few words, and then we'll ask our panelists to introduce themselves.
Thank you so much, Angie, and I am just really excited to be here with you, and just so appreciative of your leadership and your willingness to step up and to listen to folks. So thank you. So I'm Peggy Flanagan. I'm a state representative, and I'm really proud to be running for Lieutenant Governor with my partner in justice, Congressman Tim Walz. There's so much clapping.
It's a very enthusiastic crowd.
It's really great. You know, we've spent almost the last year traveling around the state, listening to folks, and I have to say that this is the #1 issue that we hear no matter where we go across the state of Minnesota. And we know that we need to make sure that more folks have access to coverage. As Angie said, you know, getting that bill in the mail or healthcare, it shouldn't be a partisan issue. We should want everybody to have access to it and have it be affordable. We need pathways for folks. We need workforce development. We need to make sure that we're controlling costs, but really that healthcare and people are at the center of our policies. It's not a conversation about health insurance, it's about health care. So my hope is that we get to hear a bit of that from our friends who are here today. But I just want to talk a little bit about just my own experience with healthcare for a moment, if I may. I oftentimes, when I introduce myself to people, I talk about my story and moving to the community that I have the pleasure of representing in the legislature. I moved there with my mom when I was just a baby, and she had a Section 8 housing voucher, and we were able to access housing in St. Louis Park. We relied on public programs like the Child Care Assistance Program, SNAP, free and reduced price lunch. But I am sitting here in front of you today alive because of Medicaid. You know, I had severe asthma growing up, and it impacted my family tremendously. So I am here because of the investment that folks were willing to make into me and in my family. But just before school started in September, my little girl, Siobhan, she's 5, was just getting ready to start kindergarten, and she was hospitalized for asthma. And genetics are really powerful. And here I saw my little girl, you know, with her nebulizer and you know, the doctors coming in and out, and something that was so familiar to me as a child, and now watching my own child go through this. But when I knew what was happening, I knew she was having an asthma episode. We got her in the car, we got her to the emergency room, we got her the care that she needed, because I felt like I could do that. We had coverage and we had insurance. Shortly thereafter, I went and I toured the Franklin Hiawatha homeless encampment and talked to a school social worker there who shared with me the story of a mom whose daughter has asthma and who's roughly the same age as my child. And it was hot, it was humid, it was sort of dusty, and she needed to keep that child in a tent because she knew that she was having an asthma exacerbation. Now, that mom and me as a mom, I'm not a better mom than that mom. I simply had access to care. And we need to make sure that these barriers do not separate good parents and bad parents, but that everyone can simply provide the care for their child, for their family, and for themselves to be well. So I appreciate that all of you are here, especially today, as we come together and talk about our vision for One Minnesota, where everyone has coverage and can really focus on their care. So enough from us. We want to hear from the folks up here. And so if you could please just say your name, where you live, and then just share your story. And we'll start over here. We'll sort of go down the line. And just thank you again so much for being here. We'll start with Janet.
Great, thanks. Good afternoon, everyone. My name is Janet Silversmith. I'm the CEO of the Minnesota Medical Association. The Minnesota Medical Association is the state professional association for physicians and physicians in training. And we as an organization are dedicated to making Minnesotans the healthiest in the nation and Minnesota the best place to practice medicine. So I'm here today because we are a nonpartisan organization. But we have a set of values and goals that we are trying to accomplish, specifically around making sure that everyone has access to high-quality, affordable health care, and that all Minnesotans have insurance coverage. And so to the extent that these candidates or other candidates are willing to work with physicians of Minnesota, and physicians can bring us stories of patients who they see every day, because frankly, life is a pre-existing condition. And so we want to make sure that policymakers who are making decisions that affect all of our lives know what really matters and how we can make policies and decisions that are in the best interest for all patients. So I'm delighted to be here to lend our support to those policies that can improve access, reduce barriers to coverage and to care, and improve the affordability of care. I also personally happen to be the spouse of someone who was diagnosed with a chronic condition as a teenager through no fault or actions of his own. So ensuring access to that coverage is personally very important as well. So, thank you.
My name is Mark Fresconi. I live in Egan. My story is about my son. I lost him 6 years ago to the opioid epidemic. Of course, at the time, we didn't know that there was an epidemic going on in our country. He was just another 30-year-old man whose life ended prematurely. I can tell you that we tried to get his mother to come with me to talk about it today. It's been 6 years. There's no easy way to talk about this, and so she wasn't able to come. It's not something that you ever get over. When someone leaves your life like that, there's no reconciling it. I mean, you just become a different person. I don't remember really who I was before my son died. And so one thing that came up with our congressman was I immediately saw that he was going to go after our health care. And if Ryan had been alive, he would have been excluded as a pre-existing condition because he had an opioid addiction. They specifically exclude people with that condition so that they don't have to deal with them. And so I've been writing Jason Lewis and calling Jason Lewis and picketing at Jason Lewis's office for the better part of all of my spare time for the last 2 years. And I can tell you that after all that time, I've gotten 2 form letters in response. I was promised by his staff, and we have it on tape, I was promised by his staff that I was on a list, that I would get a chance to meet with him and talk about my health concerns, and to this day I've not been contacted. I followed him around when he had his sham town halls across southern Minnesota, none of them close to any of the population areas. I stood outside of each town hall where there were empty seats and let Jack Dyer, his office manager, know that I was there and that I had put in for a ticket and I had been turned down, and I wasn't allowed entry to any of those. So for me, the healthcare issue it's almost ridiculous how hard these guys are working to take away the healthcare that so many people are relying on to stay healthy. I think that's what I got.
Thank you so much for sharing.
My name is Dawn Burton, and I live in Chisholm, Minnesota, so that's why I was a couple minutes late, sorry. Traffic's not great.
We have a transportation plan.
Fix the road, please. Anyway, I'm a wife, mom of 5, usually great kids. 4 boys and a girl, and we have a connective tissue disorder. And, you know, my kids had a 50-50 chance of getting it, but they wound up losing the genetic lottery somehow, so all 5 of them wound up with varying degrees of this disorder. It's called Ehlers-Danlos, and it can cause things from not just problems with your joints, it can cause problems with your eyes, with your circulatory system, heart murmurs, problems with your skin, and you know, things like, serious things like you're more prone to arterial, intestinal, and uterine ruptures, so aneurysms. And you know, it's just, because of that, the doctors at Mayo Clinic who diagnosed my oldest son, because of his disabilities, so more pre-existing conditions, said that my children and I should have an echocardiogram done every year. Now, I don't know if y'all have priced echoes anytime, but 6 a year, not a chance. My dad had the same disorder, and he wound up at 61 dying after having his valve replaced because he had a mitral valve prolapse, which is caused by this disorder. And he was, you know, he was an avid outdoorsman. He poured concrete for a living. He was a Navy vet, and at 61 years old, he died from this. And you know, I've got, my youngest is 11. By the time he was 3 or 4, he had dislocated his elbow 3 times. Second ER visit, the doctor says, "I'm going to show you how to do this yourself." And I'm a healthcare worker, have been for about 25 years almost. But that was a new one on me. My 16-year-old, Wesley, he is this big 6'3", size 15 shoe wearing kid who is extremely brilliant and the one that will support me in my old age, I hope. PSEO classes, college and the schools classes, straight A's, but he has a heart murmur. So that puts him at a higher risk, you know, for the aneurysm. You know, I've got a 19-year-old daughter getting ready to start college, and I wonder if we didn't have insurance and be able to monitor this, you know, would she be able to have children? Would she be like me and wind up with a hysterectomy at 32 years old because of this? You know, it's just, Wesley is this fantastic kid. I mean, he volunteers at church, in the community. He shovels our elderly neighbors' sidewalks for nothing, you know. But if, you know, there's things that my kids have never been able to do, contact sports, wrestling, football, hockey, so that was kind of hard. But to know that this could affect my kids in a way that could result in their death, that's very scary for a mom. That's, you know, one of my biggest fears right there. And what might be just as bad is knowing that as they get older and on their own, and they have to buy their own insurance, that they may not be able to get insurance or to get any kind of affordable coverage. So it's, you know, it'll be out of reach. And this is not going away, you know. And you know, it's hard. You know, I have friends whose kids have died because they didn't have insurance, and it's like a ticking time bomb because you don't know. And you know, for me and thousands of others, it's not just an economic issue. This is a life or death issue for us. So my husband also has, you know, I just, as a visual, these are the appointments that he has for the next 30 days, doctor's appointments. There's 16 of them, about 1 every couple of days. I can't imagine. You know, heart specialists and everything, I can't even imagine. So this is, you know, really important.
I had just moved out on my own, just landed a full-time job. I thought I was doing adulting wrong when I was diagnosed. I was nauseous for a couple months. Doctors kept sending me back and forth. So they did a CT scan and they found the tumor on a Tuesday and my brain surgery was on a Thursday. So it was very hard having to go through a month of radiation and 4 months of chemo treatments. But thankfully during all that time, I was employed full-time at a copy and print center in Staples. So even though I was on medical leave for a little while, I still got that insurance. Now, my treatments ended in 2017, so I went back to work, and I just couldn't handle it. I stayed for about 7, 8 months, and then I left because I couldn't handle it anymore. And then I was without insurance for a month. It was so hard because my family members would be like, okay, you're struggling with this, you should go and get it checked out. And I'm like, yeah, I know, but I don't really have the money to afford that right now. So it's been calls back and forth to the States, and I was on medical assistance for a month, and it's been so helpful because now I have thyroid issues. So one thing they didn't tell me is that the proton beam radiation could affect my thyroid. Of course, it didn't show up until months and months later. So again, I think I just suck at this adulting thing, but it's not that. It's just that I am the unlucky person who gets diagnosed, and it's frustrating to have to tell your employers, have to tell your friends about this, because they don't know what you're going through. They just assume that everything is handled okay, they're on their parents' insurance plan, and it's a fight. I'm having to go through these health issues when at the same time try to handle my insurance and call my healthcare providers to tell them that I changed insurances and getting bills in the mail and having to make all these adult calls about that. It's just been really hard to go through this whole process of cancer and having to fight and advocate for myself as well. So I officially am cancer-free. They removed all the tumors. But I still struggle to this day, and I can't even return to a part-time, let alone a full-time job. So I rely on state insurance, and if that is cut, I'm kind of SOL. So that's my story.
Thank you, Kelly.
Yeah.
Thank you. Sometimes we all feel like we suck at adulting.
Yes. Who's adulting? That's it.
All right, well, my name is Pam Fontem, and I am a cancer advocate. I lost my dad to pancreatic cancer, and boy, it lit a fire under me. I'm a nurse, and I was so frustrated that I could not do anything to help him. Pancreatic cancer is a pretty terminal disease, but I discovered a way that I can fight back. I mean, I can fight. I've worked a lot with Representative Walz. You know, we've done a lot of cancer research funding. We've done things in our state with palliative care. We've done a lot of things, and so that's why I want to make my voice heard. You know, and it's like, yeah, my dad passed away, and then all of a sudden, my best friend Lisa, here in the audience, she was diagnosed with breast cancer, age 30. I mean, who expects that? Nobody. I mean, Kelly didn't expect it at age 20. And so I've just been a voice. I volunteer with Cancer Votes, which is just basically says that cancer is an election issue. Like Angie was saying, basically red, blue, white, it doesn't matter. Cancer doesn't care. I don't care. I just know that it matters. It matters to all of us. When Lisa was diagnosed, you know, she was able to get really good care. I did tell her I was going to talk about her. She was able to get great care because we live in a state that does have some amazing facilities. But one of the things is basically it was before the Affordable Care Act. And it was one of those conversations of, my gosh, I'm pretty much never going to be able to change jobs because now I have a pre-existing condition called breast cancer. I'm going to have to stay in this job. It's a good job, but how do I know this is the job I'm going to want in 20, 30, 40 years? And then all of a sudden the Affordable Care Act was passed. These protections came into place, and now she has the flexibility of being able to go where she wants, not necessarily because where her insurance says she has to stay, or she makes that decision and now her family doesn't have insurance because she decided to, I don't know, become a nurse practitioner and change jobs, which is what she's going to be doing. And then also, you know, you look at Kelly, and it's like she's now on Medicaid. We need the Medicaid expansion, you know, it's like the right to work. That's ridiculous. Kelly's full-time job is to fight cancer and to make sure that she stays healthy. Do we really want her struggling to get a part-time job in order to be able to stay on Medicaid? I mean, those are the things that matter to me, matter to my friends, matter to many Minnesotans, and I'm here to make sure that everybody, I'm going to hold people accountable. So,
start. So if you have a question for a panelist or for the panel, please feel free to ask your question here. Right here, raise your hand and we'll bring you on. But let's go here. Oh my goodness. Here we go. First, part of the problem is when we focus on healthcare cost is the price and availability of life-saving medications. When you're elected, I like the confidence. What are one or two first steps you would take to address the serious pharma problem? Well, you know, I want to answer this question so badly first, but Tim, I'm going to let you go first if you'd like,
Yeah.
since you're going to be the next governor.
Well, and first I'd like to say, as you heard this, and our purpose of this is again, people pay attention, whatever you say. I know they get tired of it, but campaigns should be the opportunity, as I said, to elevate this. This healthcare discussion better never get too far from what you just heard here. That's what the discussion is about. And any scariness about, you know, oh, it's gonna be a government takeover. If you don't have insurance, you don't give a damn who's taking over insurance. You just need it. You just need it. That distracts us from the real issues on this. And the pharma issue is the one that really challenges people. And I want to be very clear about this. Pharma's not big tobacco. They are producing things that save our lives. Many of these, we have to have access to what they're making. But when that becomes the knowing that we are a captive audience, those who keep wanting to talk about a market, you have no market if that is the life-saving drug you need and they can raise that price as much as they want. So some concrete steps we could do, and we did it in Congress, to make sure that if there's going to be a change of more than 10% on drug prices, that those are published ahead of time and that the discussion happens. I don't know if some of you saw this. This is the kind of stuff that it's very difficult when there's so much out there to try and track, that in the renegotiation of NAFTA, pharmaceutical companies won big. They won exclusions against generics and price discoveries that could come down, and gave them another 10 years of exclusiveness on their drugs that are going to drive up prices. That happened at night in basically the middle of everything. So this issue of making sure, and I think it comes back to this, on price transparency on services, price transparency on drugs, making sure that we as a state, I think as a nation, we have got to win this fight. And this is that intersection between state and federal.
That's right.
Because I'm not naive. Medicare and Medicaid and the VA system underpin much of what we do. And I have seen, and just something just as simple as what we do at the VA to buy bulk purchasing of pharmaceuticals drives the price down on those formularies massively. And why we're not doing that for Medicare, Medicaid, making sure that happens in Minnesota. So first thing is starting to get at the price discovery. It's bringing those folks in. And again, I'm just going to call it out again, and I say this because you know the pain, and you heard Mark's voice, and there's nothing any of us can say that is ever going to make that any better. But we're trying to tackle this and know it's going to take money to do that. And instead of being partners with us in the pharmaceutical industry last year, they deployed 28 lobbyists to put pressure on people when we were simply asking for a way to help fund and alleviate this. We were not demonizing them. We were not saying that. We were saying you are part of this, be part of the solution. Instead of using that, they used political clout and brought that hammer down, and now we don't have the money to do that. Those are things we can do in the state.
Well, this is a really personal issue to me as well, Tim. As I think about the cost of pharmaceutical drugs, I actually had responsibility for 4 years of my career at St. Jude for the health plan at St. Jude. And so I had 18,000 US covered lives in our health plan, and I had to actually sign the checks every quarter to pay for that health care. We were self-insured. And I also had responsibility outside the United States, or my team did, for cost in the UK and Canada and Germany and France and other healthcare systems. And I can tell you that that experience left me with a simple fact that Americans are paying too much for their healthcare. We are paying too much. And so part of the prescription drug battle, right? Tim mentioned this part of it. It's why is the biggest health system in America not negotiating for prescription drug costs? Medicare, why are we not negotiating? Why are we allowing and strengthening in a trade agreement brand name drug companies' ability to pay for delay of generic providers? Do you know that only 10% of prescription drugs in this country, 10% of actual pills sold, cost 70% of the dollars? Why is that? Because the brand name drug companies cost so much. The biggest driver of health costs at the St. Jude Medical Plan was the cost of specialty drugs and compound drugs. You think just regular formulary drugs are expensive, you just wait until you see what they're charging health plans. This is not, healthcare is not just an issue in an individual marketplace. It's not just about Minsure or any other plan. Americans, employers are paying too much for their health care, and that's why Americans aren't getting a raise right now, because businesses are having to just try to keep up, one of the reasons, with the cost of health care. And so we're gonna have to take on some very big special interests in this country. We're gonna have to take them on, and as Tim said, 28 lobbyists standing up against you, handing out campaign cash to my opponent. He has taken $1 million, about half of his campaign contributions in this cycle have come from special interest PACs. Half of it, half of it. So we have got to get serious about this, and then I've heard Mark and Julie, his wife, tell their story before about their son. And what I'll tell you is, some of you have seen ads with my son Josh. He's almost 21 years old. The ads are that he's pursuing an advanced manufacturing degree. But Josh is adopted, and his birth mom died of an opioid overdose. So I have committed to my son that with every breath in my body, that I am going to work not just for the medical therapy that is needed once we create addiction, but why are America and New Zealand the largest opioid addicts in the world? Why is that? Direct-to-consumer marketing laws in this country. We have got to look at this in a very holistic fashion in this country again, and you better bet I'm going to fight like hell to make sure we do. Thank you. Next question. Maybe I should get someone who can see. What are your plans for stopping the loss of rural hospitals and healthcare services? Many folks have to drive more than an hour to access necessary care. Peggy, jump in if you want to answer any question anytime. I'll just answer quickly. Look, I think one of the best investments we can make in this country is high-speed internet. And that may be an odd answer to this question, but it's not. If you want to create remote health monitoring, remote health centers, there are some really interesting models that are being worked on at Fairview right now, where they're putting a nurse practitioner out in the middle of greater Minnesota communities. And as long as you have high-speed internet and technology, then you can link right up, right there with your nurse practitioner, with your cardiac specialist here in the cities. So we have got to open our minds about how we provide healthcare in this country. Hospitals, they get a little bit of money to hire their fellows, right? These doctors in training. We should pay them more if they're willing to put them in rural areas of the country. There are all kinds of things that we can do. And Tim, I'm going to let you answer this, but then I want to turn back to the specialists in the physician community to also give us an answer.
Yeah, no, and I want to echo that. At the risk of blowing this as a Minnesota Lutheran, when you do something good and talk about it doesn't count. I'm going to do it anyway. And you're supposed to have somebody else talk about it for you. And Angie's exactly right. I just saw yesterday, we worked really hard on this issue of aligning electronic medical records between the DOD and the VA. Because the physicians in here know that electronic medical record is a diagnostic tool that is a powerful way to provide care. This ability to also have the high-speed broadband and use that for everything from mental health treatment, where we do remote mental health treatment in our veterans, to the ability now in peripherals to do skin cancer and other things, and of course it saves a lot of money. And the Association of Health ITs just honored us for that work, but it wasn't the honoring us, it was the ability of building these coalitions to make this happen. And let's all be very clear, this issue of rural health care and consolidation becomes very, very emotional. It becomes very much at the core of our communities, and the one is very clear here is in Albert Lea, when the decision was made by the Mayo Clinic to move some of those services to Austin and 20 miles away. In that situation, one of the biggest things we're going to have to do in healthcare, it wasn't that I was questioning at that time whether Mayo Clinic was making the right decisions on finances, was making the right decisions on patient safety. I assume they're going to make those decisions right because of the reputation that they have. But the community was in the dark, did not know why this decision was being made. A city of nearly 20,000 people now would be in a position to never have another child born there. That is something that was basically unprecedented in the country, and it bodes what's on the horizon. And I think the Medical Association maybe has some ideas on this, but Angie's right about incentivizing, and I think with our senator and our representative here, state of Minnesota's done good things on this. We've incentivized that, and we met yesterday up in Duluth with a first-year medical student who's going to take advantage of the program from Minnesota, wants to stay here, and if we incentivize them, we pay back some of their student loan and their medical school debt to take a job in a rural community, exactly what she wants to do. That's the role of where government can incentivize and help and let that person go on. But this is going to be, and I think all of us need to be prepared for this, this idea that these things come upon us and then we're like, oh, who would have known? Albert Lee is just the beginning of this decision of closing this. And with Mark, I have to say this, Mark, in 2007, we did a bill called Step Pain Management on the floor where experts in the field, especially at the VA, were telling us if we don't get a handle on this opioid situation, the epidemic is upon us. That's 2007. And so the idea for you to lose your son years after that because we didn't address it, that is unacceptable. Here in Minnesota, we can't wait till rural hospitals close and access, because at that point in time, even if you have health care, and even if you can pay for it, if you can't get in to get a physician, we have to keep that in place as part of this discussion, so.
Yeah, thank you for the question. I would concur that it's a critical issue. In fact, just a week ago, we were talking specifically about the reduction in available maternity wards in rural community hospitals. So I would submit that, it's a complex issue, no doubt, and there's a lot of solutions and ideas to pursue. The three that I think come to mind as we think about this, I think technology is critical. I think having access to internet across the state, the ability to do remote monitoring, to connect with specialists in urban areas is critical. I think part of the reason that rural hospitals struggle also is because of the workforce. We need to make sure that there are nurses and nursing assistants and physicians, primary care physicians in particular, in rural communities. And we have a workforce shortage in primary care that we are not tackling as a state or as a nation in significant ways. And we need to invest in medical education, in training of other healthcare professionals, and we need to create incentives to keep people in rural areas. Minnesota is actually ahead of many other states with our rural programs. The University of Minnesota Duluth Medical School in particular has a unique focus on training rural primary care physicians. The third thing I think we need to think about is how do we pay for hospital services? Most hospital services and other services are paid when you're sick. So when you show up is when the organization or the facility gets paid. Why can't we figure out a way to sustain the core services of a hospital rather than rely on them dragging people in for potentially unnecessary services as a way to keep their doors open? So I think we need to look at how we pay for hospital care and other health care in the state.
As we're talking about rural healthcare issues, and I'm so glad that yesterday our campaign was able to meet with some medical students who are in that very program. Because when you talk about rural health, you also need to talk about tribal health and health in Native communities as well, and making sure that we have physicians who are trained in culturally relevant care and that we're able to treat our own people and also live in communities. Connected to all those issues as you talk about workforce are access to housing and ensuring that folks have a affordable place to live, which we know is a huge issue in Minnesota, and it's about childcare and knowing that as we're having conversations with people in greater Minnesota, we've got folks who are driving 45 minutes to bring their child to childcare and then an hour to their workplace and back and forth. And so this is one of those issues when we talk about healthcare, we talk about rural care, we really need to look at the whole person, the whole family as part of our overall strategy for treatment and accessibility for those issues.
Well, clearly next time we need to allow 2.5 hours for this meeting. I'm told we've got about 5 or 10 minutes left. So what I really thought we could do is maybe just come back to some of the panelists who haven't talked a lot and tell us, what would you want us at the state and the federal level to really focus and work on? Give us what you want us to do.
Okay, goodness. So let's see, I can start on the state level. So with Cancer Votes, we did a questionnaire. Thankfully, you guys have already responded, but I can share with the panel. Some of the issues that we are working on is tobacco. So we know that 95% of people start using tobacco before the age of 21. So as a state, we really want to increase the age of tobacco sales to 21. 13 communities in Minnesota have already done that, mostly urban. I didn't mention I am from Lake City, so southern part of the state. I want that to be statewide. I want to protect all of our kids, not just the urban kids. And I don't know that we're gonna get that done unless we do it statewide. We don't have any funding for tobacco cessation and education after 2020. Our services are getting cut. And so we need to figure out, that was part of the provider tax that was helping with that and some other stuff, but we need to figure out how we're gonna get those services back to our state. Thirdly, would be the healthcare access fund, again with the provider tax, and how are we going to, get that long-term funding. Federally, I would just say, would be, research. And then also we actually have the tools to completely eliminate cervical cancer globally. And so, how we can get that.
I think research is so important. The brain tumor I was diagnosed with is found in kids 14 and younger. I was 20 when I was diagnosed. I asked the doctors, okay, why did I get this type of tumor? And they didn't have an answer for me. A lot of these pediatric cancers don't receive research and funding, so we're using treatments from 30, 40 years ago because nobody cares about pediatric cancer. And it personally impacts me and impacts the things I do in life and the people I make relationships with, and it's not something that I would have signed up for.
Absolutely. Don?
I think one of the issues that was touched on was the pharmaceuticals. I mentioned my son who has some disabilities. He has epilepsy and Tourette's, and extreme upper body tics where it causes him pain. The last course of medication that Mayo Clinic wanted to try him on before doing deep brain stimulation surgery on him when he was 16 was an orphan drug used for Parkinson's. Now his father had insurance on him, I had insurance on him, and he had Medicaid. And after the drug company discount and his dad's insurance and my insurance paying for it, Medicaid was paying about $1,800 or so a month for 30 pills. And I can't imagine, that's ridiculous. That is absolutely ridiculous.
But if Dawn was in a non-Medicaid expansion state, that's reality right there. That's the decision of what happens when so that person by zip code is the separates the ability to be able to get that drug or not.
I'm originally from Missouri,
Yes.
non-Medicaid expansion. My entire family still lives in my hometown, and I'm one of 6 kids. And my sister and her children have the same disorder, and they can't, if you're not under 18, pregnant, 6 months postpartum, or disabled, you do not qualify. It doesn't matter.
And when you cast a vote in Congress, it's not just pushing a button. There was an opportunity to make Medicaid expansion for every state. Some took it to court and challenged against it, and they pushed the button to say no. So I bring that up because, again, I can't stress enough, I watch this happening for these folks up here. These are not theoretical political games to see who can make the best argument on things. That comes home very, very personally. And that decision, thank God, here in Minnesota, we have Medicaid expansion and have the ability.
Any final thoughts?
Yeah, well, a couple. So not knowing what was going on about the opioid crisis when we lost Brian, I of course since learned a bit more, and it's gotten to the point now where I think the last estimate is 115 people a day are dying from this, and I think last year they said 40,000 people from just opioid overdose. It was close to I think it was 74,000 of total addiction deaths last year in 1 year. 70,000 more people that died in Vietnam in its entirety, and we can barely get our current congressman Jason Lewis to take a look at this. So that's one issue that is really important. The other thing is healthcare availability. Like Tim said, you don't care where it's coming from if you don't have it. And so one of the things we wrestled with Brian before we lost him was in and out of treatment programs and all the different services that we had to try to bring to bear. And if we had better health care, we might
any final thoughts, Janet?
Yeah, just briefly, I would say from our perspective at a federal level, there is room for improvement in the Affordable Care Act, but we can't go backwards. We can't go backwards. So we would certainly urge preservation and fixing and patching together locally. I think we would share that coverage locally, the expansion, preserving Medicaid coverage, it's a significant rural issue. We think there's opportunities. There's a lot of inefficiencies in the systems and administrative waste, and we think we can squeeze some of that out and let those professionals who are taking care of you spend their time with you and not doing paperwork. And the final thing I would say is we know that when you see a doctor or other healthcare professional, that only represents probably about 20% of how your health is improved. A lot of how your health is improved occurs in your communities and in your families.
Yes.
So we would support investments in prevention, safer schools, safer streets, safer air and water. So
Healthy food, so.
Sure. So I just am so appreciative that everyone on the panel joined us today and that you shared your stories with us. They really matter. And as we're talking about and we shared this vision with all of you, we know that the next month or so is going to be really important to both protecting the care that folks have as well as working to expand the care that people have access to. I do want to just make one comment here because I see that we've got some folks who are from the This Is Medicaid Coalition who are in the audience. And knowing that there are low-income families, low-income working families who are struggling to be able to care for their families. And this is an issue where we reject this notion that some people are in and some people are out. We believe that everybody needs to have access to health care. I think I was worth the investment, and believe that our families in Minnesota deserve to have access to real health care. So thank you for the work of This Is Medicaid and the 100 organizations that are part of that, and thank you to all of you for being here today. I really appreciate it.
No, just, I would echo everything that's been said, and this does not have to be an issue. This should be the issue that unites us. This should be the issue that looks for solutions. This should be the issue that results matter far more than the rhetoric that's out there. But again, I want to say it till I'm blue in the face. It's always about people. If we bring it back to people and their lives, we're going to find solutions. So I'm grateful all of you take the time, and what you say does matter. It does matter to be involved in this, and I'm at a time and a day maybe that it would be easy to be cynical and watch what'll pass for political rhetoric south of us. That's not what it's about. It's about improving lives. It's about finding real solutions. It's about working with folks who maybe have a different perspective but have the same goals. So I'm grateful all of you would seize the opportunity and be here with us to help us learn this. So thank you.
I just want to end with, this is only the start of a conversation. We're just getting started. We're just getting started in this congressional district, and we're just getting started to actually get to a point in this country where every single American has quality, affordable health care. We're only getting started. And I reject the premise that this has to be a partisan issue. And I refuse to believe that we can't work together in this country again. And if we send more people to Congress who refuse to take that as the answer, then I think we'll have a better Congress in the future. So thank you for being here. It's an honor and a privilege. It will be my life's work to help us fix health care, should I have the privilege of serving this district. So thank you so much.
Thank you.